is just as important, especially when you're thinking about the minority community. Is a stigma with therapy. A lot of people tend to focus on it within their households or reach out to religious practice, which is fine. It does work, but a therapist in itself, they're qualified, a true therapist, a professional therapist. You're dealing with a qualified person who's actually setting time to sit with you and speak about difficulties that you may be having, some type of distress, and they're there to actually help you and provide you with different approaches on how to view and understand your emotions and your thoughts. So that's what a therapist is. You have different types of therapy. You have a counselor where you're just talking about what I just mentioned to you, where they just speak and they're going over your emotions and your thoughts. And then you have a psychodynamic psychotherapist. That individual, they tend to focus more on your bringing your unconscious to your conscious, getting you to understand your behaviors from when you were from your earlier experiences and seeing how it relates to your current experiences. So those are the differences between therapists. But overall, it all falls under the umbrella of mental health. We have different types of therapy that you can go to. You can go to therapy for individual counseling. You may go to therapy for couples counseling. You also may go to group therapy. The least, the most affordable one is actually group therapy. Group therapy is something that anyone can do, does not need to have, it could be a drop in session. You may not need a consent for like continued service, which means you're able to go to a group session at least once. And they focus on various topics. It's quickly for you to find group therapy. It's just a search online. You could use Google and you just type in anger group counseling. And you can find many places in your area that may offer group counseling for anger where you're able to pay no more than $25 for a 45-minute session and be able to maybe learn some tools to help you with anger management. You also have individual and you have couples therapy. Both are effective, both are needed in different stages of our life. I myself, I'm a practicing professional psychologist where I practice and I have couple therapy. I offer couples therapy, I offer individual therapy, and from time to time group therapy. Couples therapy is actually a big clientele of mine at this moment, and mostly it's just all dealing with the distress with COVID happening, and now with Black Lives Matter, the movement, the protests. There's a lot of fear. There's a lot of fear there. There's a lot of mixed emotions from everywhere. And therapy, I'm just letting you know, is something that you should probably consider if it's causing some distress in your world, if you're unable to function, if you are finding yourself not in your routine and you're finding yourself more in distress, there may be some therapy that may be needed. I just want to be clear that in this session, in this live session, this is just informational. I have not appointed myself as a therapist for the attendees that are there, and I just wanted that to be clear. So, speaking about therapy, once again, let's talk about, how much it costs. A lot of people are concerned with cost. When you say therapy, I can't afford it. I just can't afford it. It's very expensive. And it is. It's a very expensive price, but we have to keep in mind the perspective of our health and understand the purpose of it is for our health and to feel better. So I say that to say if there was a physical element and you wanted to get better, you usually are not asking the cost, but your health insurance covers it. But the main thing is, regardless of the cost, you're really focusing on the fact of getting better. And you have to kind of look at it from that perspective. But if therapy is expensive, you need to know that health insurance at this present time and long, and it has been for many years, covers therapy. everyone who has health insurance can obtain a therapist. How do you go about doing that? You can go online to the website of your health insurance carrier. You can call them directly and they can give you therapists in your area. They could give you therapists outside of your area. As long as it's within the coverage area, does not have to be within your home area, you can get one. You have the coverage, you can get a therapist. Now, having the coverage and getting a therapist, they would offer you, usually it's about 4 to 6 sessions if it's for immediate counseling. And afterwards, if more is needed, then you get into diagnosing. Now, with diagnosing, that's where the hiccup come with therapy. I myself, I do not accept health insurance at this current moment. Some reasons I'll tell you have to do with health, with confidentiality. And therapy in itself, confidentiality is very important. And a lot of people want to know that their information is being shared and is private and no one will know, because a lot of stuff get exposed in therapy. You may find out about some real harsh crimes from your client itself. You may find out about harsh crimes from a client and their relative, and none of that stuff cannot be disclosed to anyone. Even if there's legal involvement, it's still very difficult for a therapist to release their records, um, unless always an unless. But just know the client has privilege at all times. It's like 90% time the client has privilege. So when you're in therapy, everything is confidential. The only hiccup with health insurance is if you're in therapy and you are using your health insurance to cover, the health insurance have a right to ask for the notes. And asking for the notes, the therapist will have to release the notes. They will let you know about the release of the notes, the consent, of course. But because they're paying for it, they do have access to those notes. And once it goes into their hands, the cannot be liable for what happens with the information. So you have some individuals who would rather just pay out of pocket because they don't want the uncertainty of wondering if the health insurance, what would they do with their information. So that is like the pros and cons of having health insurance and paying therapy directly. If health insurance is something that you do not have and you still feel like you can't afford it, there are also other options. Therapists have something called sliding scales. Sliding scales is actually based on your actual income. So not all therapists accept sliding scales, but basically it is where the client itself will present their income to you, and you will determine what would be a feasible amount for this person to pay for the 45-minute sessions. A lot of therapists does offer sliding scales, and it is affordable to someone who do not have health insurance or who just wants to get it at a lower rate and do not and can't afford to pay the full amount. So that will be something that we could talk about of how much it costs. One big question that I really wanted to go over was a therapist relating to someone. That's a very big question. I'm looking for a therapist that relates to me. I'm looking for a therapist that relates to me. I am of African American, Black background, and I do have some clients who calls me and they're very happy for the fact of I'm Black, so I do relate. And I just wanted to help with that information and have you understand as a professional in therapy that relating to someone, a therapist cannot view it that way. We as professionals, we do know that a client is our client and we have to try to explore who they are from their own viewpoints. So even if there was a chance that I could relate to someone, you would never truly really know except for the color of what you see. But as far as the experience, you have to focus more on is this therapist, are they asking me questions about myself? Are they trying to figure out who I am? Are they exploring my background? Are they exploring the conflict that I'm presenting to them? That's really the main thing that you should look for when you're looking for a therapist. You want someone that will listen to you, that will be empathetic to you, and have unconditional positive regard, meaning that whatever you bring to the table, they're able to really just listen and try to explore your thoughts. So relating to someone is really good for perception, but just be a little careful when you just focus on the race of a therapist, because you may miss out on some qualified people. And I say that to say, an experience of being of a different race, I've had the pleasure of counseling many different backgrounds. And if they viewed it from the standpoint of, I just want to relate to someone, I know myself, I pride myself in the therapy that I give. I'm not saying that I could save the whole world and help everyone, because sometimes you just may not be a match. But I will say that I explore, and that's what you want to look for in a therapist. You want to look for someone who's exploring who you are for what you put on the table because of your own personal experiences, and keeping in mind that everybody personal experiences is retrieved is perceived differently. So we can all be of the same race, but my personal experience and your personal experience, I may have a different understanding of it. So with that being said, I just wanted to speak on relating to someone and just realizing that you want to be able to make sure you ask the questions and find out if your therapist will explore who you are. The next question was if you needed therapy, and I think I touched on this already. And basically, needing therapy is just speaking about the distress. Is there, if there is any distress in your life, are you at risk with something or someone? So those are like the alarming questions that stand out when you're speaking about if you may need therapy. Keep in mind, therapy in itself, regardless if you're paying for it or not, they all, like 98%, allows you to have a free consultation, which is about 30 minutes. In that 30 minutes, you will learn a lot. You will learn if you're in the right direction, how you should look for another therapist. If for whatever reason that's not a good match for you, there's a good resource, Psychology Today. There, most of the therapists would go there to put their profile up. So if you was to use your health insurance, you could check with your health insurance to find out what therapists will take your health insurance, and then you could take that individual, go to Psychology Today, because 95% of them will register there, and find out more about that therapist, and then schedule a free consultation with them. It's free, and you could get a lot from that 30 minutes of what you need to do to actually get the help that you need. One other big question I wanted to go over with therapy is knowing when to stop, when to start. Can I stop therapy? Can I not? You have that right to do whatever you want when it comes to receiving your help. When you are going for therapy, you're going for treatment. If for whatever reason you're not getting treated anymore, for the simple fact that, let's just say, you seem to go there every week, and every time you go you feel the same way, there's nothing happening, it is okay to let your professional therapist know that I don't feel like I'm getting any better, and that professional therapist will receive that information and be able to help you figure out what will be the next step. At no point of time, if a therapist is not helping you, are they to try to convince you to stay in therapy. Their job is to make sure they're benefiting the client. So if you ever find yourself in a situation where you do have a therapist and things are just not going your way, when I say your way, meaning you're just not getting better and you feel like you put your all into it based on what the therapist have presented to you, then you do have that right to change your therapist. Your health insurance will change it right away. But giving a therapist notice would not give them, make them feel any less of an individual or feel like they wrong you, because not every therapist can actually meet the expectations of everyone. So it is possible that they lose clients because they're just not meeting the expectations of each other. Sometimes the therapist may feel like what is being brought to the table they may not be experienced in. And by our own ethics code, if we are not experienced in the type of therapy, we are to refer them out. So if you are seeing a licensed, a professional psychologist, a professional therapist, they follow those same rules, and they would know that if you came to them, propose that conversation, what they would really need to do. So this is just some information for you to know as far as that is concerned. The next thing I wanted to talk about, and I don't see any other additional questions, is just speaking about therapists in itself and what they do. A lot of times people get it confused about who's who in therapy. Um, there's a very famous lady. I think her name is Iyala. Sorry if I screwed up her name, but she's very famous in what she does. She has her own TV show and she does a great job with what she does. But I just wanted to put it out there that that's not considered therapy in itself, because what she does, what a therapist will not do, is she gives a lot of advice. She's very hardcore and she kind of tells you what you need to do based on her own personal viewpoints. And if you are a trained therapist, that is not the correct way. A trained therapist will never give you advice. They will have you explore your thoughts, but they will never give you advice. They're not judgmental at all. They're just sitting here trying to listen to your thoughts and your feelings. So if you have a therapist now and you're in a session and you seem to think that every time you walk away, what should I do next? And they're giving you the response, you should do this, you should do that, sounds like you're more in a life coach situation. And there's nothing wrong with it, but a therapist, the main thing that a therapist want an individual to do is to be able to make decisions and be able to kind of use the approaches that they learn in therapy to figure it out independently. So if we were to give advice, you would be dependent on us, and that is not what we would like. We don't want you to develop a dependent personality. We want you to develop and continue to have an independent viewpoint for yourself. So I wanted to be clear about that when you're reaching out for a therapist, to be sure that that individual is not giving you advice. And one last thing, when reaching out to a therapist, sometimes we get therapy and we have different approaches. There's an approach to be mindful of. It works for everyone, but there's an approach called eclectic approach. Eclectic approach is, it works well with a lot of people. Some people just like to discuss what's happening in their life, just say on a weekly basis. But an eclectic therapist, what they're doing truly is just discussing what's happening on a weekly basis. Usually, when you come to therapy, you may say, I'm dealing with these thoughts, something this, I'm having distress, anxiety, depressive symptoms. That therapist should want to continue with that particular treatment plan on a weekly basis if that's the time frame that you're seeing them. They wouldn't actually speak about your day at work or ask you how was last week every week. If you find yourself with a therapist that's doing that, if it's working for you, great. But just so you know, with therapy, there's treatment plans. They follow treatment goals. They focus on what it is that you wanted from the beginning. They review their treatment plans to go over them to see how you all are progressing in therapy. And those are the therapists that they continue to work on what is truly happening. That is how they were trained. You could get away with how you're doing once a week here and there because things happen, and sometimes you need to just focus on the present. But just bear in mind, if that continues to happen, that this person may not be giving you their all. And this is just strongly my opinion on that as far as being trained. So that's just my take there. Do anyone have any questions before I wrap up? I see a couple of more had joined in. Any questions? You could just post them in the chat. Okay, crickets. No. But yeah, so basically in a nutshell, guys, I have on my page itself www.drtlawrence.com. You could read up on more information about therapy and how to go about it, where to get it from, how do you know if you need it. Once again, this I am not anyone's therapist in this session. I'm just providing information. Even on my website, there's a lot of information there just for reading to find out more about it. At this current time, there's a lot of resources for therapy because of the state that we're in presently, and it is needed. Couples therapy has increased tremendously. um, Couples abuse have increased, so that is why couples therapy has increased. And I just wanted to say that if it's needed, please don't be afraid. It's not a stigma. No one knows you're in it. It's 45 minutes, and it can actually help you. And you can go, oh, and you do not have to go every week. You could go every week, bi-weekly, depending on the therapist, but you could have short-term sessions where you could see them for up to a month, up to 60 days, and maybe stop. But keep in mind there's a free consultation there, and that's something you want to explore. And if you have no more questions, I will thank you all for joining in my Instagram live. Thank you. Bye, everyone.